There's also been people who've suggested I should be fired out of a cannon.
Yeah, I've seen that.
I owe my life to the NHS. It saved my life when I went through kidney cancer, and that's the sweet spot for me, is how to improve care for people and value for money for the taxpayer, because the two things often go hand in hand.
Hi, it's great to meet you. Great, thanks. So, huge welcome to the North East and Middlesbrough in particular. It's great to have you here. I was just wondering, Wes, if you could tell us why you think it's so important we have a national conversation around the NHS.
Yeah, so I think people can see the biggest crisis in the history of the NHS. Every part of it, whether it's ambulance response times, which is a really big deal here in the North East, people struggling to get a dentist appointment, again, North East at the sharp end of that. Also GPs, A&E response times, right across the board you can see an NHS that is not always there for people when they need it.
Right.
Doesn't mean there isn't great care being delivered every day, but the great thing about having a new government is the chance to have a fresh pair of eyes, and you can just be honest about the state of things without your political blushes being the priority. So we've hit the ground running. There's lots of things we are already doing and will be doing in the coming weeks and months. But at the same time as we're getting the NHS back on its feet, I also think this is the right moment to think about the long-term future of the NHS, and crucially to make sure that people are involved in shaping it, because this is something that holds a special place in the hearts of everyone in the country. I owe my life to the NHS. It saved my life when I went through kidney cancer. Lots of people have similar stories and experiences, and crucially it's the experiences, I think, that we're interested in. So whether people work in the NHS, crucially whether they use it, I want those voices, those experiences to help shape its future. And I genuinely think, and we're already beginning to see through change.nhs.uk, brilliant ideas that would otherwise not necessarily pass the lips of people who walk through my door every day. So it's a great opportunity for everyone who has a stake in the NHS to shape its future.
I think it's fantastic, and I think you've pointed towards change.nhs.uk. I've been on the website, there's been some amazing ideas that have been shared. Can you tell us of any particular ones that you've seen that have come across that are interesting?
Well, one of my favourites was the suggestion there should be a Wetherspoons in every hospital. I'm afraid we will not be able to deliver that. Chancellor said no. There's also been people who've suggested I should be fired out of a cannon.
Yeah, I've seen that.
But we knew when we launched the website that there would be the kind of boat in at boat face type suggestions. And my view was that unless you create the space for those jokes, you don't create the space for the serious ideas, and you end up with something that's overly regulated, overly managed, and feels phony and puts people off. And also, on a really cynical level, if you're one of the 5 million people who saw the Archbishop of Banterbury on Instagram taking the mick out of some of the joke suggestions and clicked through to the website, we're drawing people in who might come for some of the joke suggestions, but then hopefully will give us some of the more serious experiences. Some of the ideas that have stood out most powerfully are the ones that aren't the revolutionary ideas, like being able to book your appointments online, like trying to organise things like tests and scans within the same blocks of time so people don't have to take more than one morning or afternoon off work. These are the sorts of things that really matter to patients, but if I'm honest, they're not the sort of things that come through my door at the department every day. And so I think it's already giving us more of the patient voice. I think the other thing I'd say is I've made a lot of effort in the last few years, first as Shadow Health Secretary and now as the actual Health and Social Care Secretary, to listen to frontline experiences, not just leadership experiences. No offence to senior leaders in the NHS, but they do tend to get a lot of time with ministers. And actually I think it's a lot of the frontline staff who can see some of the waste, some of the inefficiency, and some of the things that really frustrate them because they stop them from delivering great care. I want more of that feedback because then I can help bulldoze through some of those problems.
I think it's so refreshing. I think trying to get opinions from staff, and most importantly, patients and members of the public, is something that I really encourage, and I think this idea through change.nhs.uk is really fantastic, and it's honestly really refreshing to see. I wanted to ask you, Wes, there's 3 core things that I'd like to talk about, if it's okay. One of them is around making sure we bring prevention to the forefront, and I think that's something that's coming through quite strongly. Can you just tell me what you think around that and why you think that could be really important?
Well, one of the big challenges for the NHS's long-term future is that we've got a growing ageing society, rising levels of preventable disease, things like cardiovascular disease, diabetes. These are preventable. Type 2 diabetes certainly is preventable, and there are things we can do to both keep people healthier for longer and reduce the cost on the NHS, because if demand keeps going up and cost keeps going up, at some point we're going to be whacked in our pockets, either through higher taxes or through people, because the NHS isn't always there for them, opting to go private, and we're seeing that in really high numbers, and then there's unfairness built in.
Yeah.
I think keeping us healthier for longer is a really important thing that all of us can play a part in. But that's where public conversation becomes even more important, whether that's ideas like expanding community initiatives like Parkrun, which have been really successful, or people saying, actually, we need government to step in and regulate a bit more on things like junk food. That's where I think a genuinely national conversation is really helpful.
You mentioned running. Are you a runner yourself? Or?
No, I used to be. I used to really enjoy cross country at school. I hate it now. I actually prefer swimming. One of the challenges in the last 4 months, before the general election, I got into a real routine of like swimming a couple of times a week. In the last 4 months in government, it's gone in the opposite direction. In fact, I was at a G7 health ministers meeting, and we were all joking about the irony of health ministers basically finding it harder to stay healthy because of the demands of the job. So we've all got to work on work-life balance, and I need to start practicing what I preach.
No, completely. I know earlier in the conversation you mentioned it was really important to not only get the views of managers, but importantly those frontline clinicians who are really seeing what's happening day to day. And I think, like I said, that's really commendable and very innovative. How do you think we can plan for the long-term workforce, not only to make sure we have the workforce that we need to deliver excellent care for the public, but also to make sure that they're properly equipped, thinking of things like digital?
So the long-term workforce plan needs to make sure we've got the right people in the right place at the right time delivering great care.
Right.
And so we're not just thinking about the numbers of people that are needed today, but the types of roles that will be needed in the future. If we've got more AI-enabled diagnostic scanners, for example, or they can strip out a lot of the demand on staff time through speeding up the process so you can get through more people. In terms of community nursing teams out in the community, we can do much more surveillance, diagnostics and treatment in the comfort of people's homes. In fact, while I've been here in Middlesbrough today, I've been out seeing a guy with urinary tract infection. He's been in and out of hospital until the community team stepped in, and now he's getting all of his tests, all of his care at home. Better for him in terms of his experience, also better value for taxpayers. And that's the sweet spot for me, is how to improve care for people and value for money for the taxpayer, because the two things often go hand in hand. People can't get a GP appointment, for example, it costs 40 quid. They end up in A&E, which costs 400. Worse for them and more expensive. So we're trying to improve care and bring down cost at the same time.
I really like the point you made about you've been out in the community. Again, thanks for doing that. That's really important to see what's actually happening in people's homes. And it's really refreshing, to be honest, to see you doing that. Have you got any other ideas as to how we can make sure excellent care is delivered in the community, in people's homes, and why that's so important?
Yeah, I mean, I think district nursing's got a big role to play. I think it's had a golden age. In more recent years, it hasn't felt like that. I think, to be honest, talking to a lot of district nurses, we need to rebuild district nursing back to the potential I know it has, because I've seen firsthand the difference it makes. Keeping people out of hospital, providing timely access to care when people would otherwise be kept waiting, and also really important support for the wider family. And I've seen that firsthand, and also seen it firsthand in my own family as well. So I want to see much more community teams. And the great thing with technology now is that we've got so much diagnostic potential in our own pockets, or we can give people wearables, which means that people can observe patients as they would on the ward, except they're in the comfort of their own home, which is a much better place for them to be in terms of their own well-being. Also a much safer place, because actually sometimes I think people feel like they're being rushed out of hospitals. Actually, it's for really good reason. Like much higher risk of infection, much higher risk of things like muscle wastage and physical deterioration. So often if we can get people out of hospital, it's much better for them, as well as being better for the taxpayer.
Yeah, it's really refreshing what you said. I mean, my own experiences of working in the community, especially in palliative care, is that district nurses do a fantastic job. So great to hear you saying that. Wes, I know we've got to wrap things up soon, but if people want to share their own ideas as to how to improve the NHS, what should they do?
Visit change.nhs.uk. We've had some brilliant ideas already, and there are a couple of ways people can feed in. There are surveys about people's own experiences, but also you can feed in your ideas for change. You can give your reaction to other people's ideas for change. So it's a transparent exercise. Yep. People can feed in. We are reading them. In fact, we're not waiting to publish the plan next May to start acting on some of those ideas. So in the next few months, you're going to see things like our plan to cut NHS waiting lists, which are drawing already on some of the ideas coming through. So this is a genuine consultation. People's voices are being really heard and acted on. And I hope that means when you see the 10-year plan for the NHS published next May, you will feel that your fingerprints are on it, that this plan belongs to all of us. It's not just me coming in to impose change as a new Secretary of State and a new government, but this is a team effort, that this is the country's plan for the future of our NHS. It's such a special institution. It has such an important role to play in all of our lives. It's going through the worst crisis, but I genuinely think we can turn it around, get it back on its feet and make it fit for the future. And you can play your part by visiting change.nhs.uk.
Fantastic. Wes, thanks so much for your time. It's great to have you in the North East and excited for what the next few years has.
Thanks very much, and thanks for everything you're doing as well.
Thanks.
Thank you.
Thanks, Wes.